and I want to know my doctor.
Beneath all of the change, all the uncertainty, all that is new, you get to the core of it and it's still two people trusting each other.
I'm their advocate, willing to take the time and the energy to make sure that they do get the type of care that they need.
The physician who knows you, knows what medicines have worked or have been problematic in the past.
I talked with several doctors, and I chose someone I have confidence in.
You really have to work with a health professional that you can trust.
HMOs are much more likely to have board-certified physicians than if you just look through the phone book to find a physician, but they do select their doctors very carefully.
My doctor in the HMO goes out of her way to give me personal care.
It's a wonderful feeling. I mean, it kind of brings you back to the old physician in the small towns that took care of, the whole family, and that you do see many generations, which is fun.
She cares for me, and so do the people who work with her.
I chose to be a nurse because I care, number one, but I like working with the seniors because it's a fulfilling thing. I helped someone today.
To treat everyone like they're your own parent or grandparent, and to treat them with dignity and respect.
I want to be healthy.
The vast majority of them are very active, very engaged in life, and they want to stay healthy.
There is so much that can be done now to improve not only quality of life and longevity.
Keep on going and doing things and bring new hobbies. Start line dancing and doing things that they've never done before.
I think HMOs may be an answer to the health needs of the future.
As we all encounter a lot more change, we have to read the details of what we're getting ourselves into.
Talk to the HMO representative, you look at the benefits, you think about it and think about how it compares to your needs.
What the rules are, what the limits are.
The HMO responsibility is to treat you appropriately, answer the questions, provide the guidance through the physicians and other healthcare practitioners that help you maintain your health. Older Americans have really voted with their feet to join healthcare delivery systems, and the rate of increase in the numbers of people from year to year joining HMO style of systems is really quite stunning.
It is assuring to know you have security in your pocket without having to pay too much money out of your other pocket.
I believe in managed care because I think it's the only way we're going to be able to provide health care for the whole country in a way that we can afford. I think the American public deserves good health care, not worried about losing their life savings because they're going to get sick. The senior population is the population that is very best suited to HMOs.
Aging can be frightening. You enter a time of life you only know from helping your parents cope with it.
They like to hear about, my life, personal life with, children and that. And it's amazing. I mean, these people that are in their 90s remember when their kids played baseball, Little League, and when their kids were in Girl Scouts. And it's sort of a bond, even though many, many years apart, that they can sort of bridge that and find out that I'm a person that does know medicine, but I'm a person that likes people. And I think that helps them to understand that I'm really here for them.
I have that peace of mind, knowing the HMO is always there, 24 hours a day. I tell that to anyone.
The experiences you just heard summarize the feelings of many Medicare HMO members. They found the Medicare HMO option to be the right choice for them. The question is it the right choice for you? Let's examine the Medicare HMO option, how it works, and how you can decide if it's right for you. What is a Medicare HMO really? An HMO, or Health Maintenance Organization, is a type of managed care plan. Under managed care, members receive medical care through a network of doctors, hospitals, laboratories, pharmacies, and other healthcare providers who have agreed to work together to provide healthcare services for negotiated fees. Medicare HMOs are sponsored by the Health Care Financing Administration, the federal agency that oversees Medicare, and must meet their strict coverage requirements and quality standards. When you enroll in a Medicare HMO, you're no longer covered under Medicare Parts A and B. The Medicare HMO replaces both parts. Medicare HMOs provide services for a fixed premium paid mostly by Medicare on your behalf. In turn, you use the HMO for all of your health care needs. Except for an emergency, you must use an HMO's network of providers to receive benefits. If you don't, your care isn't covered. And because Medicare HMOs replace coverage under both the Allied Signal Retiree Indemnity Option and Standard Medicare, they're easier to use. You don't have to coordinate between two health plans for your coverage. No coordination means no complicated claim forms for you to complete. Got it so far? Here's more. When you enroll in a Medicare HMO, you'll choose a personal doctor known as a primary care physician, or PCP, to coordinate all your care. Your PCP is someone who knows your complete medical history and monitors all the care you receive. Your PCP will always be your first point of contact when you need care and, if necessary, can refer you to another doctor for specialty care or arrange hospital admission. When you choose your primary care physician, you'll select from the Medicare HMO's network of carefully screened doctors. If your current doctor is already a member of one of the HMOs offered, you can simply write his or her name in the space provided on your HMO application. If not, refer to the HMO provider directory for a list of participating doctors. So what about Medicare HMO coverage? Most of the health care services you receive from a Medicare HMO, including hospitalization and surgery, are covered at 100%. You pay a small fee called a copayment that's typically only $5 to $15 for each doctor's visit. There are no deductibles to meet, and in most cases, no claim forms to fill out. Your doctor does the paperwork for you. Also, Medicare HMOs provide coverage for services that aren't covered by standard Medicare, like prescription drugs, vision and hearing care, and coverage of some dental expenses. And because Medicare HMOs emphasize preventive care to keep you healthy, you'll be encouraged to get to know your doctor to help detect problems early, and you'll be covered for services like annual physical exams, mammograms, blood pressure screenings, and cholesterol testing. Finally, many Medicare HMOs even go a step further, offering programs that promote a healthy lifestyle. Benefits range from educational seminars on subjects like nutrition and diet to cardiac exercise classes and discounts on health club memberships. All of the Medicare HMOs available to you have been carefully reviewed by Allied Signal and a team of healthcare experts for quality and service standards that go beyond Medicare's requirements. But it's important for you to keep in mind that each Medicare HMO is unique, and while coverage under the plans is similar, you may find that the benefits differ slightly. You'll receive a decision kit with more information on Medicare HMOs, including a personalized enrollment guide. The guide defines your options and compares the benefits of each plan available to you. If you have questions about the specific benefits offered by an HMO, contact the HMO's Member Services Department. If you decide to try the Medicare HMO option and aren't satisfied for any reason, you can switch to Standard Medicare on the first of any month. You can re-enroll in the Allied Signal Indemnity option twice a year, effective January 1st or July 1st. If you wish to make a change, the customer service representatives at RBA can advise you of the steps you need to take. But remember, choosing a Medicare HMO is a personal decision. If your current doctor doesn't participate in a Medicare HMO and you're unwilling to change doctors, the Medicare HMO option may not be right for you. Keep in mind that if you join the Medicare HMO, your care must be provided by the HMO's network of doctors to be covered. Also, if you travel frequently and are away from home more than 90 consecutive days a year, you may not be eligible unless the HMO offers reciprocal arrangements with HMO provider networks in other areas. Finally, there are other enrollment restrictions based on your current medical condition. Contact the HMO's Member Services Department for details. On the other hand, if you want health care that's easy to access and less expensive than the indemnity option, and you want to take advantage of preventive care and dental benefits, or if you like the idea of no deductibles and 100% coverage with just a small copayment for most services, a Medicare HMO may be right for you. And you won't have to worry about exceeding reasonable or customary limits that can add to your out-of-pocket costs, or completing all that confusing paperwork either. You will have to choose a physician from the HMO's network who acts as your family doctor and coordinates all your health care, but that's a big part of what makes the Medicare HMO choice so personal. So what do you do if you make the Medicare HMO choice? First, carefully read your Medicare HMO fact book and personalized enrollment guide. They summarize the Medicare HMO option and provide specific benefit information offered by each plan. If you're ready to enroll, complete the Medicare HMO application for the plan you choose. The pre- and post-age 65 enrollment forms are included with the HMO's list of providers in your decision kit. Send the completed forms to RBA in the postage-paid envelope provided, and you'll receive your new medical identification card before the effective date of your coverage. Or, if you wish to stay with your current plan, there's no need to submit any forms. Your current coverage will continue. Now that you've heard all this, you may have some questions about how the plan works or about choosing a primary care physician. Each HMO has its own member services department with trained customer service representatives to answer your specific questions. To receive accurate information, be sure to identify yourself as an Allied Signal retiree. Also, RBA customer service representatives are available to answer your questions at 800-526-0744. So there you have it, Medicare HMOs, a high-quality alternative for your health care. Take some time to review the materials you received and consider your choices carefully, because choosing a health care plan that's right for you and your family can help bring an important quality to your retirement years: peace of mind.